Assistant Professor from SNS College of Physiotherapy. Today we are in our clinic. We have a patient with a chronic low back pain, and our mentees are going to present a practical aspect of treating the patient with the low back pain using an electrotherapy modality called short wave diathermy. So let us hear it from our mentees about the introduction of the case and how they are going to give a dosage of the treatment and how it is going to work out and what are the contraindications they need to check out and how we can integrate this in our rehabilitation protocol. So what is the case, and tell me something about it.
Good morning everyone. Today we present the case study on the use of short wave diathermy to manage the low back pain. The case details patients who are age 45 years, occupation office worker, pain intensity 6 by 10, aggravating factors sitting more than 30 minutes, forward bending, relieving factor rest. Clinical findings: reduced lumbar flexion, paraspinal muscle spasm, low radiating pain.
Okay, according to visual analog scale, VAS scale, the patient reported the pain of 6 out of 10. So the patient is having a moderate to severe range of pain. So we are going to treat it with the short wave diathermy. So what is next?
Next is mechanism for the short wave diathermy, and we can commonly use for the chronic pains more than 3 months, and commonly used for muscle. Mechanism for the study is producing the electromagnetic agitation heat energy. It affects means by physiologically improve the blood stress by vasodilation and improving the metabolism rate and reduce the exudates from the lungs. So it promotes the heat.
As he told, physiological mechanism of short wave diathermy in treating the low back pain. So the heat which is given by the modality is penetrating deep to the tissue. So inside the tissue it increases the blood flow, thereby increasing the oxygen supply and nutrients necessary for the depriving tissues, and that will help to enhance the tissue healing mechanism. So thereby the patient will reduce the pain sensation. For about how many days we can give the treatment? We can give it for at least a week or 2. Then only we can feel the good, better outcome. So what is next?
So next is the application and dosage. So for SWD there are 2 methods of application.
Yes.
So which is continuous SWD and pulse SWD. Yes. So in continuous there will be a thermal effect, but when it comes to a pulse there will be no thermal effects. As the case is chronic, so we are giving him the continuous SWD. So as it produces a heat which is a thermal effect, so there are some parameters for these conditions, which is a frequency 27.12 MHz and the duration is for 15 to 20 minutes. Then the intensity should be a mild comfortable warmth. So there are some contraindications for this. We have to check for the precautions. The precautions should be a metal brands or some other metals they were wearing. So next should be the skin resistance checking, and there must be a proper spacing between the electrodes. So based on the spacing of electrodes, there is a method which is co-planar method for SWD.
Yes. So in this case, we have positioned the patient in prone line for the better comfort, and we have used the pad electrode in which it is placed in a co-planar method, so that the better outcome can be achieved evenly for the entire low back pain. As we said, the wavelength frequency and the intensity according to the tolerance of the patient should be monitored throughout the treatment session. So what is next?
Contraindication and safety measures. The contraindications are pacemakers, pregnancy in lumbar region, malignancy, metal entrance to the treatment area, and active infection. The safety measures are therapist will measure a safe distance, therapist should regularly check the modality, and patient feedback during the treatment.
Yes, patient feedback during the treatment, in the sense the patient should feel the mild warmth-like sensation, not a burning kind of heat, or not even a heat-like sensation is also not acceptable. So mild patient's warmth sensation should be addressed during the treatment. That we have to ask from the patient continuously throughout the treatment. And we should not interact with the electromagnetic transmission of the waves during the treatment session. We have to be in a safe distance away from the patient. So what is the next? How we can incorporate this in the rehabilitation?
SWD alone is not sufficient.
Yes.
Along with it should combine with each other. SWD is for reduced pain and spasm. Stretching of stretching for lumbar extensor and hamstring also used. And strengthening for core muscles enhance the strengthening. Posture correction and ergonomic advice, which is important for office workers can be used. As expected outcomes are pain reduction, increased range of motion, and better functionality. Started diathermy is a useful adjunct for mobility, modality in chronic low back pain or pain relief and muscle relaxation. But active rehabilitation is the key for long term.
As he said, he is an active office worker, so he needs immediate pain relief. For the emergency pain relief, we can use electrotherapy modality to get some better result in pain reduction. But electrotherapy modality is not a sufficient one to treat the patient. We have to incorporate exercise therapy like stretching and strengthening, and we have to advise them an ergonomic modification in his work environment and also in day-to-day activities so that he can get a better outcome. So that is all about this case presentation, right? So hope you all understood about how we have to start with the patient treatment and how you have to incorporate it to the entire rehabilitation protocol. So we'll see you in some other video. Thank you.